ozone therapy. You use ozone in your practice. How?
Yeah, we do. Ozone is used by me as a disinfectant for the tooth before we put a restoration or a filling back into a tooth after the mercury has been removed or some other deficient restoration. We use ozone inside the mouth as if a tooth has got trouble, if it's still sore after somebody's had a root canal many years ago and the tooth is still feeling cockeyed, if you will. So I know that works because I've seen it over and over and over again.
So somebody with tooth pain, you go in with the ozone and the pain goes away?
Yeah.
Really?
Yeah. Now it may not go away the moment you put the ozone in, but over the next few days, and we have people come back a week later and we want to have an evaluation, and people say it's gone 50, 60%. Do you want to have another injection or not? Most of the time people say, yes, I want to have another injection, and they're painless. I give a little dental anesthetic, gets the area very comfortable, and then when we put the ozone in, it has no pain. And that's great because then that knocks the pain out the rest of the way. I've been able to salvage implants from that kind of infection. Dental implants can have infections, they're not perfect. But you can take and arrest the infection with ozone.
You just shoot it in or spray it in, this ozone gas?
Yeah, so depends on the application. For ozone is a gas. The way we're using it for this application that we're talking about is a gas. So I actually physically inject it into the inside of the cheek, up in the fold of the gum, and that's where it's placed. And it just goes.
And it kills the bad bugs?
It does.
Like any bad bacteria, kills it?
Eye
Really?
contact.
Nobody could dispute this.
Nobody can.
So how come all dentists aren't using ozone? If what you're saying is true.
I'm ahead of the pack. Okay. I'm just ahead of the pack. I've started using ozone probably 4 or 5 years ago. I'm not the trailblazer, but I'm ahead of a lot of people in using it. And I've been using it in a lot of different ways. Surgeries, we use ozone and we ozonate our waters. So when
to disinfect everything.
Right, so when we're in a surgical situation, we need to have irrigation and washing things away. I've got ozonated water, ozonated sterile saline that we're putting down into an area so that it's killing the bacteria while we're getting a 2-for-1. So we're killing bacteria and we're washing away whatever it is that we're having to wash away. So it's a really neat opportunity to use that.
Now, I read your book, but I guess when you're in the dental chair, a lot of people don't see, but there's a lot of bleeding oftentimes that goes on, right? There's a lot of bleeding going on.
There can be, yeah.
So all the bacteria is going into your bloodstream, according to my medical doctor buddies.
Yeah.
So ozone, by disinfecting it with ozone or with your laser.
Yeah, they both
that's
work.
what, less thing going into your body?
That's right. And not only that, either of those tools, laser and ozone, will both seal the blood vessels, okay? It will stop the bleeding.
So here's my question, because ozone disinfects the area.
Yeah.
And laser disinfects the area. So what's the difference? Which one's better?
It's a simple answer. It just depends. You can't use certain lasers on teeth without having other problems happen because the energy is too concentrated. But you can very safely bathe the tooth with ozone without any consequence. So you can pit the tooth with a laser that you don't want to do, but you won't pit the tooth with ozone. It'll just kill the bacteria. So it's invisible to the tooth structure, but it's not invisible to the bacteria.